All righty. On the show today, Michael Pine from Health West is all about suicide awareness. Welcome to the show, Michael. How you doing today, sir?
I'm doing good, Paul. It's good to be back.
Good to have you on, man. The numbers is not looking good in West Michigan and all over the country. Let's talk about suicide and mental health, man. What are you seeing?
Well, I think the last time you and I talked, I had talked about how we actually saw a reduction in suicide numbers cross country in 2020 during COVID. We saw a pretty dramatic reduction in
Mhm.
suicides. And I always want to be really careful when I talk about this because there was a drop, and it was probably the first serious drop in 30 years. It's the suicide rate's done nothing but go up. And if you Google right now, if you Google, suicide rates America, and you look at the most recent stories, you'll see a whole bunch of stories that'll tell you the suicide rate dropped during COVID. But a lot of those stories, what they don't tell you is that the suicide rate has increased for children and it's increased in the African American community.
Wow.
Now, obviously, 2020 came after, or 2021, came, and we sadly here in Muskegon County, I feel like we're starting to see an increase. But the really tragic part, for me anyway, the really sad part too, it's hard to lose anybody to suicide regardless of age. But we had not lost a young person under the age of 18 to suicide in about 4.5 years, and from January 2021 until about March or April, I believe, of 2022, we've lost 5 children to
Wow.
suicide, and
Five
that's been tough. Yeah.
Wow.
And then of course, the other deaths. So we're out there. The Suicide Prevention Coalition is here. Health West is here. The pandemic, I don't know if I brought this up to the last time we spoke, but the pandemic itself probably has not had that big of as much of an impact on suicide as one might believe, right? Um, but the economy will, and we know that for a fact that the economy, if we're headed into bad economic times, and we're there now, right? If people can't drive to a doctor,
Right.
people can't drive to the grocery store and afford to buy groceries, the economic impact on people's mental health is far more serious than even a global pandemic. So we have some concerns as we move forward, and not just about suicide deaths, but what they call deaths of despair. Alcohol-related deaths are on the increase. Overdose from opioids and other drugs, a dramatic increase. Higher in Muskegon County, your uh, overdose deaths are higher than suicide deaths. And so these things are very concerning. So deaths of despair would be alcohol related, drug related, and of course suicide deaths. And when we see economic hardship coming our way, we see an increase in all of those three categories of death.
What
Wow.
what about attempts?
Well, the sort of rule of thumb that I've seen over the years that people will say is that for every death by suicide, there's 25 attempts. But I think for anybody who's ever listened to a police scanner, even here in Muskegon County, I mean, you can turn it on just while you're making dinner for half an hour, and you're probably going to hear mental health calls. And I'm not saying that they're all about suicide attempts, but I think we have a lot of people struggling, and I think that rule of thumb, maybe 25 attempts for every death could be accurate. But the number of people who maybe don't get to the point where they're attempting, but they're seriously considering, which is still scary, right? If that's your loved one, if that's a family member or somebody you're close to who's maybe not had an attempt, but is seriously considering suicide, that's really scary. And those are difficult waters to navigate with that family member, that loved one, or that person you go to church with. And so those numbers are very high. We see the surrounding hospitals, well, our hospitals here in the community, of course, but we've heard even from Gerber spectrum Gerber outside of our county, but let's face it, a lot of people in the northern part of the county would perhaps go to Gerber before they would drive down here, closer for some people. And we also know Children's Hospital in Grand Rapids has seen an increase in their emergency rooms for young folks.
Wow.
It's a challenging situation, but I do think there are things we can do, and there are things that we need to be aware of. There's some steps we can take at least to hopefully mitigate this situation.
Talk about those steps, Michael.
Well, one of the first things I would say is, first and foremost, we got to talk about suicide, or we've got to talk about mental health. You don't have to talk about suicide. Let's have a conversation about mental health, and let's have a real serious conversation about it. So we're out there doing presentations. I mentioned to you, so I do a lot of community outreach. We do a lot of presentations, more than just suicide prevention. Most of our presentations are about mental health and mental well-being. So Stephanie Williams has come into the department, works with me. So now it's Stephanie and I working together. But we offer a lot of presentations and classes, et cetera, around mental health and good mental well-being. But in our communities, we've got to be willing to have those conversations and say to each other, hey, how are you doing? How's your mental health? Like that's a lot of times people don't want to have that conversation, but we've got to do it. It's worth doing. And I think that we can start to reduce the stigma around mental health if we can have those conversations and hopefully have meaningful conversations around it. And then the other step, as I said, take a class. The easy way is to go to healthwest.net and look for trainings. But the other thing, you can do, you can Google HealthWest and Eventbrite, and a page of our trainings is going to pop up. And I would just encourage people to get in there. I had somebody call me today, Paul, because the ads are still running on the radio station here about QPR class, question, persuade, refer. Gives you the skills to recognize some of the warning signs that maybe the person isn't talking about suicide, but there could be some hidden warning signs. So we give you what warning signs to look for, and then how to have the conversation, and then resources that you can hopefully utilize. So those are a few things. We got to have the conversation. We got to break down that stigma. Let's learn about it as much as possible. And I think as a community, we just got to come together and we have to support each other. And in our little communities and our bigger communities, we've got to just come around each other and really support each other through these difficult and challenging times.
That piece on mental health, Michael, what advice do you have for parents out there who are dealing with a child or children who they know has some mental instability, and they've turned every corner, and they've asked for help, and they're not getting the proper help they feel because their child is still dealing with things from their past or their birth?
Sure.
What can you give us?
I'm going to give you a phone number here. I'm going to give you a couple of things, and I'll make a couple of statements about HealthWest. So HealthWest, where I work, we are the community mental health here in Muskegon County. So there's a few things. First of all, if you have, as a parent, first we got to figure out what exactly is happening, right? So sometimes what I would say to parents we'll address, Rob, the parenting situation that you're talking about, but also a lot of times parents have a hard time, I have a hard time figuring out what's normal adolescent behavior and what is potentially a mental health concern that I need to be aware of. And it's hard to tease that out. So we have a presentation called Mental Health 101. I think it's about a 45-minute long presentation. I guess I'll call it a class, a presentation. And that really helps to kind of educate people about mental health concerns. Also, when it comes to youth, how do you determine when is it a mental health concern? But for the person who has come for help or turned to help, maybe gone to the emergency room, come to HealthWest, for a child, if they feel as though they're hitting brick walls and they're not getting what they need for their child, there's a couple of things I would tell you. First of all, you can call me in customer service. So the phone number in customer service for Health West, if you've run into what you consider a brick wall and you're not getting the services you feel your child needs, call customer service 231-720-3201. You're going to get me. And for the past 9 years, you would only get me, right? So we've all met now. I'm on the radio. You know me. Now you can call. You don't have to be shy. You don't have to worry about, I'm going to get somebody who's just not going to understand me. Call. But I will also say we've added another person in the department, Kelly. Kelly Betts is here to also take phone calls. And so you're definitely going to get one of us too. Okay, so that's customer service. If you have a concern with Health West, if things didn't go the way you thought, if you did not get the services you felt that you should have, you have rights and recourse that you can follow up with. And I know when you're working on getting your self-help or a child help, the last thing you want to do is probably call, make a complaint, have to advocate for your child. But in certain circumstances, you may have to. So call. And we'll try to do the heavy lifting for you, and we'll try to get to the bottom of what's going on. The other thing that I would say is for families who haven't quite gotten to the point where they've called yet for their children, we have what we call our warm line, relatively new to Muskegon County. It's staffed pretty much 24 hours a day. We're getting there with our staff, but we have a warm line here in Muskegon, 722-HELP, Muskegon County. 231-722-HELP. If you call that number 24 hours a day and you have a child in a crisis and you have deep concerns for that child, we're coming to you. We'll come to your home. We're going to come with a master's level social worker and another mental health worker, do a full assessment and make a determination of needs and take those next steps that need to be taken. Or you can come to our building on Apple Avenue, 376 East Apple. Walk in Monday through Thursday. We're open from 8 until 7 p.m. If you're coming for an assessment, you want to get there before we close, obviously. But that's Monday through Thursday, 8 to 7 p.m. Friday, we're open 8 to 5. Our Saturday hours will likely come back here pretty soon as COVID hopefully is starting to lift. But you can walk in and you should be able to walk into the emergency room and also get a full assessment. It's been overwhelming. I'm not going to deny that it has truly been overwhelming, especially with children coming through the doors. We've also struggled to maintain staff and keep staff. We're having the same experience that almost every other employer is having out there in the world. It is really challenging. And right now we are short-staffed and we're working hard. But I also want to say to people, if you come through the door and you have a mental health concern, we are going to connect you with some type of service, okay? And that might mean that you won't be served by Health West directly, but we also contract with over 300, we have community providers and contracts with folks out there in the world. We're going to connect you. But again, if you feel as though you have not gotten what you feel you need or a child in your family needs, call customer service or send an email to us. Go to healthwest.net and send an email to us. We're going to respond.
Mike, some of the situations where we've seen suicide, it was a surprise, like nobody saw it coming. So can you talk about some of the triggers of suicide?
I'll tell you about some research into suicide that we've seen. Quite often, a suicide will hit a family right out of the blue, right? A suicide will hit a family and everybody will just be devastated by it. Of course, it's a unique and a very different type of grief, right? That comes with a suicide. And quite often, initially, people will say, we didn't see it coming. It came right out of the blue. What we do know is when we go back and talk to families 6 months to a year later, and from research that we see, Usually a year later, now the family's starting to piece things together a little bit and go, there was this, and they were kind of pushing people away here, or this was happening. And sometimes right upon the death, a lot of times people will say we didn't see it coming. But then when they have time to really reflect, you'll start to have noticed some concerns. The other thing we see is when people do take a QPR class with us, and this is often really sad for me as an instructor, is you'll have somebody in that class, and then afterwards they'll come up to you and say, if only I had taken this class a year earlier or 5 years ago, maybe I could have saved my brother, maybe I could have saved my dad. And it's heartbreaking, right? When somebody approaches you after a class. And what I can tell you is you don't know what you don't know, right? And if you can't see it, you can't see it. It's no fault of your own. But at the same time, I would still encourage people, take a QPR class. Let's learn together. I did a presentation in a church a week ago or so, I think last week. And there was a gentleman in there, and he said, I have had a good life. I don't think I've ever been depressed. I've never had a mental health problem. I would have no clue about any of what I was talking about that evening in this church. And somebody else had approached him and said, this employee of yours here looks depressed to me. I'm concerned about him, and I'm worried they might be suicidal. And the gentleman who said, I've never had a mental health problem, he never would have thought that employee had any kind of issues or concerns going on, because he just hadn't had an experience in his life that would acquaint him with mental illness. And yet this employee of his was really struggling and was suicidal.
Right in front of you.
It's education. It's a matter of getting out there and learning about it. Like any other disease that can befall us, right? We got to be aware.
All right. We're going to have you back in a couple of weeks with your new partner, new co-worker there, and continue this conversation. It is affecting everybody. This particular issue doesn't have a color, doesn't have an age, doesn't have a wealth,
right?
Doesn't have a cap on it. It is out here, and you're hearing the conversation. Thank you, Mike, for being available. Anything else you want to say before we go?
No, I always appreciate the opportunity. It's always good to see you guys. You're looking healthier than me these days, which means I got to take care of my own health, right?
That guy, Rob, really that guy, Big Rob, is looking great. He's been working out. He lost weight. He's found his fountain of youth.
Yeah, and I got to do likewise. And it's good for the mental health too, right, Big Rob? Right? It's good for the mental health. When you start to feel better, your brain starts to feel better along with the rest of your body. So I appreciate it. 722-HELP. That's that warm line. Even if you just want to talk to somebody, you don't have to call it for services. If you just want to talk, just got to get something off your chest, 722-HELP. And if you want services, you can call that too. If you need to get an assessment done, 722-HELP. That's the number. Reach out to Health West.
All right. We got to increase these conversations. I'll be hitting you up more often.
We will make it a routine. I guarantee it. Okay, Paul?
Thanks, Mike. Take care.
Thank you. Appreciate it.